The psychosocial variations in grieving parental and spousal death. Grief is a person's subjective emotional reaction to the loss of a significant other. This reaction also involves adverse psychological and biological reactions. Freud considered grief as a withdrawal from the world to overcome the detachment of the lost one. There are two other similarly related terms that are bereavement and mourning, which are interchangeably used for grieving the loss of a significant one. Grief can be normal or pathologic. The symptoms of grief mainly include distress, flashbacks, guilt, hostility, anger, disturbance in routine, low self-esteem, anxiety, etc. In pathologic or complicated grief, the same symptoms are prolonged for an excessive period and with higher intensities. Several psychosocial factors may increase or decrease the intensity of grief. Children are considered to stay more in grief, especially when they receive poor social support. Good family bonding and social support has been positively correlated with healthy handling of grief outcomes. Significant dates or events such as birthdays or anniversaries of the deceased may increase the levels of grief. Death of a parent or spouse is a very significant event in one's life and may cause severe psychological damage. This significant grief may lead to several psychiatric conditions if not socially and emotionally supported. Both, death of a parent and death of a spouse, have been positively correlated with psychological abnormalities. The existing literature on the grief caused by parental and spousal death did not address the comparisons between the grief caused by parental and spousal deaths, that is, any significant differences between the two aforesaid griefs. In one of his studies, Dr. Sukoon intended to find out the same difference and to analyze the role of gender, age, marital status, education, financial status, religiosity, social interaction and occupation in this regard. His study involved 546 purposively selected participants that included both males and females. It was further ensured that the death of parent or spouse of the participants would have occurred before 6 months and not more than before 3 years, so that the levels of grief could be measured accordingly. The participants also reflected the understudied psychosocial factors such as age, marital status, education, financial status, religiosity, social interaction and occupation. Section 5 of The Grief Evaluation Measure, by Jordan, Baker, Rosenthal, Matisse, and Ware, was used after seeking a formal permission from the authors. The study found no significant difference between the levels of grieving parental and spousal death. The analyses based on gender also revealed no significant differences in the levels of grieving between men and women. However, women were found to grieve their spouses significantly more than men. The analyses based on age revealed significant difference in the levels of grieving between young adults and adults, showing that people aged 41 and above grieve their spouses significantly more as compared to youngers. The analyses based on religiosity revealed highly significant difference in the levels of grieving between highly religious as compared with ordinarily religious and moderately religious. The highly religious individuals had significantly low levels of grief as compared to their counterparts. It was significantly reflected in their parental and spousal grief. The analyses based on social interaction revealed that socially active people grieve significantly more than the socially reserved. The socially active people were also found to have significantly higher levels of parental grief as compared to the socially reserved. The two groups had no significant differences in spousal grief. The analyses based on occupation revealed no significant differences between students, working individuals and housewives in the overall grief and the parental grief. The spousal grief, however, was significantly greater in the working individuals as compared to students and housewives. The earlier literature also reveals that women grieve more than men as wives remain more emotionally dependent on husbands and face more financial problems as widows. Loss of spouse in old age has been reported to cause severe emotional and social problems which can be encountered more easily in young age. The positive associations between religiosity and mental health and the negative associations between religiosity and psychopathology are quite well established. No earlier literature was found on the role of personality types and occupations in grieving. As the area of grief is not widely studied in relation to the psychosocial determinants or correlates, the aforesaid study by Dr. Sukoon would be a significant contribution in the relevant body of knowledge. Thanks for listening. To read the entire paper, kindly visit www.drsakoon.info.